Thank you, Dean Charney. Good morning. I would like to start with a moment of silence to show our support and love for the victims of the Pittsburgh synagogue and to show our concern for such a senseless violence. Thank you. I would like to add my welcome and thank all of you on behalf of our 50th anniversary co-chairs, Arlene Adler and Jan Correa, for coming to help us celebrate our 50th anniversary. Peter, this is your 15th year, as you said, welcoming our guests, and we thank you for that. I would like to thank the Mount Sinai Board of Trustees, Auxiliary Board, administrators, faculty, and staff. You are all incredibly supportive and cheerleaders of our program. I would like to congratulate and thank each of our honorees and thank each co-chair. You all did such a fabulous job to make this event successful. Look at this room. You made this happen. Our advisory board, under the leadership of its president, Marva Rabinowitz, has been providing vision, inspiration, and support to help our program achieve new heights. We are a better program since the creation of our advisory board. Our junior board, under the leadership of Yasmin Mack and Jerry Bruno, has been working with our patients, helping them understand finance, government, and other professional skills, as well as life lessons. I would like to recognize and thank our Business Professional Council under the leadership of Susie Greenwood and Beverly Boudon for spreading the word about the center and connecting us to so many people. And I want to thank all the volunteers here today and the people who volunteer with us throughout the year. You help us do so much more than what we can do alone. Can all the past and present advisory board members please stand to be recognized? Our junior board, they are working outside. Our Business Professional Council, and all other volunteers. We thank you, thank you, thank you. And thank you as well to all the staff of the Ziegfeld. You are really taking great care of us. Many of our staff helped put this event together, including Judy Vladimir and Sarah Porter, who are no longer with us. But we wouldn't be here today without Rebecca Anna Paul, Lydia Lucas, Christine Sogomonian, Donald Suklo, Ronnie Taveras, and Robin Wasserman. Thank you. Eileen Solomon, signed as Director of Special Event. What can I say? But that you and Mary Medina, working with your colleagues from Bell Events, and our advisory board member, Felice Axelrod, saved the day. Thank you. You are all amazing. Thank you, Check and Tech. Your expertise and technology makes registration so much easier and pleasant, and you are doing this pro bono for us. Thank you, Felice, for the connection. Today we're celebrating our 50th anniversary. To help us celebrate, we have staff and patients here from the 1970s and trainees to the present. So we have all type of people here. The very first physician, Dr. John Morgan Thohire, Dr. Henry Berman, flew in from Seattle. And the very first administrator, Jay Roberts, traveled from Florida. Are they here? If they can raise their hands. We actually have people here that came from California, Chicago, Boston, Washington, D.C., just to mention a few. Throughout the program, you will hear from our current patients and also from our former patients so that you can see how the impact of our work goes over the lifetime of the young people that we serve. To all our staff and trainees, thank you for being the fabric of our program. You are the net that keeps our patients healthy and closer to achieving their potential and living productive lives. Can all the present staff, the past and present staff, trainees, and patients please stand to be recognized? What has been the evolution of our center over the last 50 years? In 1968, Dr. John Morgenthau, a true visionary, founded the Mount Sinai Adolescent Health Center in a couple of rooms in the basement of Mount Sinai. And as they grew, they moved into 2 trailers on East 102nd Street. Initially, the program was doing substance use prevention to address the heroin epidemic that was facing our communities in the 1960s. The counselors were people in recovery themselves. The first 16 months, they served 300 young people ages 13 to 18. Today, we are the largest adolescent-specific program in the country, serving about 12,000 young people ages 10 to 24 every year. We have a comprehensive, youth-friendly health and social services system of care designed to meet the developmental needs of young people and accredited at the highest level as a medical home for them. We integrate physical health, sexual and reproductive health, dental, optical, behavioral and mental health, from head to toes, from mental to dental, all under one roof. We have a continuum of care. We care for our patients when they are well for health promotion and health maintenance. We care for them when they are sick. They can just walk into the center instead of going to an emergency room. And we care for them when they're admitted to the inpatient unit at Mount Sinai. And then we discharge them back to us. The truth of the matter is that for decades, we have been doing population health in the ultimate integrated model and in the most patient-centered manner. This is what the U.S. healthcare system is striving to achieve. In addition to the center on East 94th Street, we have full-time clinics in 6 high school buildings, and we serve through them 24 high schools and middle schools. 70% of our patients have no insurance and no ability to pay. No patient is ever charged or billed. Not a single penny ever exchanges hands. We buy their medication, we give them MetroCard. We want to make sure young people have no barriers to get needed services. The program is extremely cost-effective. We spend on average less than $1,000 per youth per year. We have great outcomes. Despite many patients being from disadvantaged backgrounds, many of our patients graduate high school, attend college, and some go to graduate school. Our patients have lower pregnancy rates, have very high rates of being immunized, and have their mental health needs addressed. If you ask our patients why do they come to the center, they will say because they feel welcome, respected, not judged, safe, connected, and accounted for. That's why they come to us. And I will say they get great health care. Without our program, the majority of these young people would go without the services they so desperately need, and their outcome will not be as good as they are. Our mission is to break down economic and social barriers to health and wellness for young people. The Mount Sinai Adolescent Health Center is an oasis in the middle of New York City and has become a beacon around the globe. There is a proverb that goes, "A single tree makes no forest. A single string makes no music." But I have to tell you that all of us together, all of us here, all of you, plant and grow the forest, form the orchestra, and then play the music in the forest that help heal young people. If each of you make this happen, you, and you, all of you. And I have to thank you for helping us give young people a place of healing and a place of hope. Thank you so much. Many people are asking at me about where my children, all my children are here. Can you stand up so that people know who you are and they can say hello? Where are they? Oh. So Gabriel Diaz, Daniela Diaz, Adriana Diaz, and Daniela other half, Kieran Lezama also.